Welcome back. I'm glad you're watching Morning Express. It is now time for your health. This week, the world has been celebrating a World Health Week, which will be culminated on the 7th of April, which is on Friday, with the World Health Day. And the theme for this particular celebration, or commemoration rather, is mental health and depression, something that many Kenyans are battling with, something that many caregivers also need guidance on how to go about. We have Michael Gitonga, who is live with doctors as well as patients who have suffered depression before. Michael, over to you.
Thank you very much, Michelle. Just like you've rightly put it, it is World Health Week, and the theme this year is depression, specifically depression. Now, the whole week is basically just to create awareness and to let people know that mental health is a major concern. And it's going to be climaxed on Friday. But today being the day that we do your health, we thought, well, why not go to location? And where we are right now is Mombasa Hospital. And Mombasa Hospital is a place that many of us do know, where they handle, it is the biggest and the only mental health referral hospital in Kenya. But that, of course, also gives us an opportunity to show why it is important for us to highlight and talk about mental health this morning. So joining me to have this conversation, to my extreme left, we have Lois Mbokola, who is a nurse in charge. Good morning, and thank you for joining us this morning.
Thank you. I
also have with me Samuel Boyo, who has been very brave and is going to be sharing with us his experience. He's bipolar and is recovering, so we're going to come to that in just a bit. Let me start with you, Lois, and tell us why it is important, first of all, for us to have mental health and depression talked about on a bigger scale.
This is very important to observe World Health Day and take into consideration depression as a theme, because we have a big population who suffer from depression. So it's very important.
Okay. Now, when we talk about depression, what exactly is depression? Is there a difference between depression and being moody?
Depression is a mood disorder, and it becomes very severe to an extent where it would need treatment, not just other approaches to manage it. So that is why it is important to look at it in a hospital.
Okay. And are there different types of mental illnesses?
Yes, we have different classes of mental illness. We have schizophrenia. We have mood disorders. We have substance-induced psychosis. Those are mental illnesses that are caused by clients or persons who use substances. We also have organic psychosis. So yes, we have different classes of mental illness.
You mentioned something about substance-induced. Can one who maybe is on substances that possibly alter your moods, be in danger of suffering mental illnesses with time?
Yes, persons who abuse substances, these are substances which will interfere with the brain, and at the long end they cause mental disorders, and depression could be among them.
All right, Samuel, thank you very much for joining us this morning and for sharing. Tell me, first of all, your understanding of bipolar.
Okay, I understand. I understand bipolar as a mood disorder disease when it has two extreme sides. Sometimes you are hyperactive when you are high, and the other time you are so low, you are depressed. Yes.
So, and if I'm correct, so that in case we refer to those terms later, when you're very hyper, is what they call manic.
Yes, that's
and
right.
When you're the lower part is the depression.
Yes, that's depressed.
Okay. How did you discover that you're bipolar?
Okay. I discovered that I was the bipolar mood disorder patient after a very long diagnosis, and after maybe 5 years is when I was totally unlikely to be diagnosed with the bipolar mood disorder. From then, from there I started my medication.
Okay.
Yes.
What is it that triggered for you? What is it that made you realize that this could actually be a mental illness? Because when you're hyper or when you're low, it's not necessarily, all of us do have moments where we're very happy. There are moments where you're a bit more pensive, you're thinking a bit more. So what is it that differentiated that from, just the ordinary hyper and being pensive?
Okay, it comes from the people. They are the ones who are telling me now you are losing your mind.
Sorry, I'll just ask you to hold this. Yeah. Okay.
You are losing your mind. I could bring things more extra than the way that we done. Like I used to sing a lot. I thought I have so much money in the bank. I wanted to go outside. I could just walk around, singing, talking so fast, and trying to say that I want to meet the president, I want to be the minister. That's when the people now started telling me, you are mad. So that's when I was taken to the hospital.
Okay. Let me come to Lloyd. That particular aspect of him being bipolar and maybe saying things that seem detached from reality, and people assume it's madness. What's the difference between now being bipolar and madness, if there is any?
Bipolar, like I said earlier on, bipolar, when in the depressive phase, the mood is on the other extreme, where the client has feelings of worthlessness, helplessness. Sometimes they don't talk a lot. The mood is low. When he's on the other side, where the client is manic, that time the patient or the client has extremes in activity. Hyperactivity, he will overdo things, and that is when the common person in the home environment will see, yes, my relative is overdoing things, and that is the time they will consult a hospital or a clinician for diagnosis.
So is there a difference? What is madness? Can you define madness?
Well, we call it, it is mental illness. Actually, when you call it madness, that is stigma, because it is mental illness. It is a mental disorder. Actually, when the public call the clients mad, they stigmatize them and they make them even fear and they shy away from seeking treatment, and they live in denial. But mental illness is there. And it is an illness like any other. And calling it madness actually is stigmatizing the patients. It is a mental health disorder, and it has classes. Like I said, there is we have the mood disorders, we have the schizophrenia, and all the different types. Just like the way you can't call a client malaria person, it's the same way you would not call a patient with this disorder mad. Mad actually is stigmatizing. Yes. Okay. They are mental illnesses.
All right. And at what age did you discover that there is a problem? For you now to actually accept that I think I need medical help?
Okay, at 24 years, that's how I discovered that I really need medical help, and I need a very good treatment so that I can stay and live a normal life. And that is when I was referred here to my dad hospital, and I was correctly diagnosed, and I started my medication up to date, which I usually take up to date. But the problem with the medication is the side effect. We have the first generation medication and the second generation medication. At first, I could not afford the first one. The second, I could not afford the second generation. So the one I used to take, first generation, they used to give a lot of side effect, and that is another challenge that we people with mental illness faces. We go through.
Now, I imagine that your bipolar did not start at that age.
No.
It probably was there even before.
Yeah, but it was there before, but I could not realize that I have it. But it was not grown, it was not overboard.
Okay.
Yeah.
During those manic moments where you want to meet the president, you imagined you had a lot of money. There were those things that you'd go through, and people thought, okay, what is going on? Do you remember them clearly? Or are
Yes.
there moments you do?
Yes, I do remember. Also, there is other that I used to do, but I don't remember them. I was like a society could tell me, could see me coming, then they chase me. They say I want to rape their children, I want to kill their children, such that things, but I could not remember me doing it. Yeah, not everything that I remember, but big percent of it, even being a patient going through this disease, you will not forget everything.
Okay.
Yes.
And now the depressive moments, what is it that you'd go through?
Okay, depressive moments, I could sleep the whole day. I could not eat. I could not bathe. I could just be so down. I could not work anything. I could just lock myself inside the room and stay there. So my parents could come and knock me and ask me why I'm not waking up. Like I spent about 2 months without bathing. That's when I realized that is when I was in depressive mode.
And during those moments, I just want to try and understand.
Yes.
Is it that you felt you did need to bath? Is it that you felt you didn't want to see the world? What was going on in your mind?
I was like a zombie somehow, or someone who has forgotten everything. But I also think it's the medication that I was using by then that kept me in such situation.
Okay.
Yes.
Lois, what is the cause of bipolar? If it is known.
Well, the cause is not really known, because in etiology, under the causes of mental illness, genetic predisposition is a cause, where you find the genetic makeup of a client is predisposed. If exposed under extreme cases of stress, they tend to relapse, and that is one cause. Drug abuse could also be a cause, but the main cause is not actually known. But mainly it is triggered when there are extreme experiences of stressful circumstances in life. And the client goes through moments where they have beliefs of worthlessness. They get persecutory delusions, where they may feel they will refuse food, they will refuse to bathe, they will refuse to talk to people, and they believe they are not worth. So this is what really will cause the client to start presenting with the signs and the symptoms, which are indicators that the client is in the depressive phase. There are other clients, when it is very severe, they will get suicidal, and they will express wishes of taking away their lives. They will start even selling or giving away valuable things or family things. They will start writing even notes and farewell messages to dear ones, which are indicators or signs that the client is getting suicidal, and that is when they are in severe depression. And at that moment, they are not able to take care of their personal hygiene. You will find their living area is neglected, is piled up, is unkempt, and therefore the client will be having those signs where anybody with the knowledge of mental health will be able to identify and tell the client has a problem and therefore seek help.
Okay, now the symptoms for somebody with bipolar during the depressive stage sounds very similar to just, not normal depression, but depression. Let me just call it depression.
Yeah, it's depression. Because many times these clients will not even visit a mental health facility. It is integrated, and they will visit many health facilities just looking for help, and until they get somebody who can identify and diagnose that this is a mental health problem, depression, which needs specialized care. Most of the population is in the general health facilities.
Okay.
And they are managed even in those facilities because in the country we are, the government has integrated mental health services with other services because they don't necessarily have to come to a mental health institution for management of depression.
Okay. Samuel, let me come back to you.
Okay.
Let's talk about stigma, because you mentioned that your relatives, people around you, would tell you that you're mad. Tell me a little bit about that.
Okay, we go a lot of stigma, especially when you know, when the people know that you are sick. They will not like to associate with you. I have so many friends, before I was sick, when I get sick, they all departed from me. Even the family members, they could say, now yours is done, you can't do anything, you are not productive. Now you are like a zombie, you are like a cabbage. Those are the words that they could use. But I used to give myself a strength and to say, because I'm not the one who chose to be sick, and anybody can get sick. That is how I tell them. You don't go and looking for diseases outside there. You could like to be healthy. So when you go to the people, it's also good to realize how they treat you, because they will stigmatize. Other thing I have discovered of late, people, you have also to respect yourself and to live with the disease and to accept the medication. I have very nice doctors here in Madari who treat and give you the therapy, the counseling, how to adhere to the drugs, so that the people, even if they talk about you are sick, that will not bother you. It doesn't bother me anymore.
Okay.
Yeah.
And what is it that you'd want people out there to know, especially for the sake of someone who might be going through what you went through and their relatives possibly just don't understand? They don't know what's going on.
Okay, I could urge the public and people out there, when they see a person who is mentally ill, to take him or her to hospital and to love and support that person. And that will make a change in the mental illness patients. Yes.
Okay. Lois, what are some of the things that people should look out for, and not just for bipolar, but for other mental illnesses? Because one of the things when I was reading is that mental illnesses can be very subtle. It can be something that just comes up and somebody thinks either you're pretending or you're acting or you're just looking for attention.
Yeah, even people could tell me that I'm working, I was acting, I could entertain people so much, they could laugh, they could stay and support me, but I was sick and I never knew. I knew as if I was doing something normal.
So some of them would encourage you to just continue.
Continue. So when you see people, suppose you are sick and you see people, they are happy, they are looking at you, so you continue doing it. It's like attention seeking. So it's a disease.
Okay.
Yeah.
Lois, how does one identify that maybe your loved one or somebody who you're staying with is possibly going through a mental illness, because they may not even know themselves?
Yeah, many of the clients with mental health disorders do not have insight, and they will not, on their own volition, feel the need to go to a hospital to seek care. Like somebody who has a headache will know, I have pain, I need to go and be seen. They do not have insight of their illness. They don't know that they are mentally unwell. So the public has a very big role to play in identifying and assisting persons with mental health disorders, because if there is a change in the behavior of a person who initially was very okay and all of a sudden the behavior has changed, the speech has changed, most of the mental health disorders impair the cognitive part of a person. The memory has been impaired, judgment has been has changed, and many of the mental capacities of a person tend to be interfered by the illness. So any person there seeing a change, a sudden change in behavior in a client, it is always good to seek and assist such a person to seek mental health care, and it is available in all health facilities because mental health is integrated in all other mental health services in the country and in all the hospitals.
Okay. Now, Samuel, a challenge that I possibly would foresee, and maybe you let us know, is the fact that this being the only mental health referral hospital, what are some of the challenges maybe you found just accessing care?
Okay. In our area, in the remote areas, you don't get the light psychiatrist doctors, so that is a challenge. That's why I stayed with the disease for a long time without getting the proper psychiatrist. Then that's when now I was referred here. That's when I get help. Yeah, the challenges are many, especially we people. To treat mental illness is very expensive. So that is a very great challenge we get for ourselves and those people who take care of us.
Do you feel now that you came here that it is accessible for you? But what about maybe those who are up country, others who possibly do not even know where the referral hospital is?
Yeah, there are so many people outside there who don't know even where the referral is, who don't know how even to take their medication, those who even don't know they are sick. And that is, I could like people, when they see such people, to take them and to bring them here, and they get help here, and they will recover.
Okay.
Yeah.
Lois, in terms of spread of mental health care, what do you know if there are any plans, and what is it that possibly would help to spread that word? Because I'm trying to imagine somebody maybe up country in the village. First of all, there could be the issue of them thinking it's witchcraft, or thinking, it's just something is wrong. But there's even the information to get out there. Is that happening, do you think?
Yeah, accessibility of mental health services is quite a challenge because we have got very few specialized doctors in mental health, but the government has also trained nurses across the country in the counties. They have been posted, and we integrate mental health services in the community. At the first instance, when a person has got signs of mental illness, many people think they have been bewitched, others think they are possessed by demons, and so they tend to spend so much time out there looking for help elsewhere before they even think of going to the hospital. But in the hospitals, in any health facility, you will be able to get diagnosed, and then the referral system is in place. In all the counties, we have got mental health units. All the counties, the level 6 hospitals, level 5 hospitals. So there we have units. We have a mental health unit in Machakos, in Embu, Nyeri, Kakamega, Kisumu, Moi Teaching and Referral. They are all across. And in the units, when they are not able to manage clients completely, it is at that point they are mostly referred to Mathare Hospital, which is a teaching and referral hospital now, to get the very specialized attention. But overall, in every county, in every level 5 hospital, we have got a mental health unit where mental health services are offered. And my appeal to the public, any client who has got mental health problems should be assisted to access mental health services. Many times I watch with a lot of concern when clients are loitering in the markets and they are really getting wasted, while the government has really invested heavily in getting medication for mental health problems. So my appeal to the public, when there is a person with mental health problems, medication is there, and in the nearest hospital, clients will be assisted and will be guided very well to get the very good services that will assist them to recovery.
Okay.
Yeah.
Samuel, do you feel after getting medical care, you are now able to function just like everybody else?
Yes, but it has been a very long journey to come back to sanity because of it is a concerted effort, doctors, relatives, that's my parents, and the health workers at all.
So now would you be confident maybe to hold a job and, have just continue with life as usual as long as you're on medication?
Job, no, because people who hear that you suffer this disease, it's not like a malaria that you will take the medication for malaria
and it clears.
And clears. It's a long-term disease. Like me, I was told by my psychiatrist that I'm gonna use medication for the rest of my life. So with that one, I know I can't maybe be employed, but I can do something for myself. Like now today I'm a hawker. I don't have a stable job, but I'm a hawker. And that's what sustained me. That's what I use after selling even to this hospital. That they're the one who supports me so that I can be able to buy my medication. So what I can say, it has really helped me, but you can go back to normal, provided you adhere to the medication. Yes.
Okay. Lois, does it mean that if somebody has mental illness, they cannot be a normal, let me not call it normal, a functioning citizen?
The persons who have suffered mental illness, once they have been managed and treated and they are on care, they are able to go on with life like any other persons. You get a mental illness, a mental disorder, you are attended, you are treated, and you go home. The only challenge with the clients with mental health disorders, most of the mental health disorders tend to run a chronic course. So they will live on medication for a very long time. Just like diabetes, somebody will live on medication and go on with their normal life, but when the sugars are high, they will need attention in the hospital. Similarly, or in the same way, a person with mental illness, at some point they need an admission, but they do very well on medication out there, and they keep jobs, they are able to move on. So given an opportunity in the community or in the society to serve in the areas where they have maybe trained, they are able to perform those duties very well, they are able to move on very well, but they are monitored and they go and do very well on medication, just like other medical conditions, like I said, like hypertension, most of those chronic conditions. Mental health disorders most of them run a chronic course. So say they live on medication. And the other main challenge our clients face is affordability of the medication. Because if you have to live on this drug for a very long time, that will mean they will need financial support to be able to access medication. Because many times when they don't access medication, the relapse takes place, and then we get them and readmitted in the hospitals. So that is a major challenge where clients with mental disorders really experience, and when they relapse, the best assistance they get, anybody who is with them, the family, an employer, it is always best to assist them to get medication so that it doesn't deteriorate, and then they are able to pick up again and move on.
Okay.
Yeah.
Samuel, in an ideal world, what is it that you'd have wanted to do?
Okay.
In life?
In life, I don't have certificates. But
is that as a result of maybe the mental illness? You're not able to finish your education?
Now when I was sick, I could not finish my education, and it takes a lot of time. It takes a lot of time before you know what you are suffering from or what was going on. But in a day world like now, I tell you, I'm a hawker here. I could like to open a shop outside there and work, because I do very well. Even the sister here can tell you I do very well in business, and I could like it to expand.
Okay.
So I wanted maybe one day, because when I'm sick, I have a lot of vigor to meet the president. I could like one day maybe to meet the president, because his term is over, and explain to him.
We don't. Okay, yeah. Carry on.
And explain to him how the mental patient undergoes and how he can help.
Okay.
Yes.
All right. So for you, an ambition, a lifetime dream would be to meet the president.
To meet the president and to tell her to assist me financially, to set up a business. And I also start a group to support and to motivate others, people who are here. Because like 10 years, there's the people we are together in the world. And I go today and find them there in the world. I feel so touched.
Okay.
Yeah.
Lois, do children have mental illnesses? Because like he discovered when he was above 20 as an adult. But do children have mental illnesses, and how do you identify them?
Child psychiatry, it's rare you'll find most of the mental health problems show up in childhood. So it is rare you will have mental disorders in childhood, because something like schizophrenia, the signs and the symptoms will start showing up in adolescence. And that is the time when the client is in school, when the client is still going through development, and that one will be diagnosed from adolescence, and it deteriorates or gets worse with the age. Similarly with the mood disorders. In childhood, one has not been exposed to a lot of stresses in life, so it's rare you will be able to see. In childhood, what is common is things like autism, such conditions, but not bipolar, schizophrenia. We do not have that in childhood.
Explain a little bit about schizophrenia, because you mentioned it, and I think it's, well, what is schizophrenia?
Schizophrenia is actually what the common mwananchi will call madness, because this is the time when the client presents with a lot of disorders in speech, in personal hygiene. The memory is also affected. They have things we call delusions. They have got hallucinations, whereas you will find them talking to people. The common person is not seeing. They are seeing them, but you are not seeing them. They are hearing them, but you are not hearing them. Those are hallucinations. So that is the common mental illness which we see. And those are the people you see in the markets carrying dirty things. And that is the common mental illness, which the common public calls madness.
Okay.
Yeah.
Samuel, we want to wind up now. Maybe your message to Kenyans out there and to anybody who is watching in regards to mental health, and what really you'd want them to know.
I could like to the public to know one thing for sure. We are people like any other people. Not to stigmatize us. When we meet, say hi to us like people. And not start saying these people are garbage, they can't perform, they are productive. Like today I'm doing very well. The job is slow, but I'm doing well. I'm able to cater for my family and to sustain myself, although it's very difficult. But I could also like people, there are those maybe who can support me with the business, and also they can support me buying medication. yeah, I think now I get a good job and I establish something.
All right.
Yeah.
Thank you very much. That is Samuel Boyo. Thank you so much. And we also have Lois Bokola, the nurse in charge of Mathare Hospital. Thank you very much for being with us this morning. And this is where now we'd like to hand over back to you, Michelle, and, well, tell us which way to go forward. But that from Mathare Hospital, we hand over back to you in studio.
All right, thank you so much, Mike Gitonga. They're joining us live from the Mathare Hospital discussing mental health and depression. That is the theme for the World Health Day that will be commemorated on the 7th of April.